The average incremental cost for everyone over the age of 18 is $6,000. So if you take every American over the age of 18, the chronic disease that we have causes every American, because we share costs, to spend $6,000 more every year. That makes us less competitive for jobs, makes us not only sicker, but have a problem in maintaining our freedom. The great news is 4 factors cost 75% of our medical costs, and our chronic disease, maybe 90% of it. Those 4 factors, you know, are tobacco, food choices and portion size, physical inactivity, and stress. And we know the answers to all of those. It's not hard to be physically active. I don't go to bed without 10,000 steps a day. You can look at my pedometer. I'm only at 7,460, so I'm going to walk up and down there. But in fact, it's easy to change these, just like Rocco did. If you look at our Medicare budget, this is just Medicare, in 1997 dollars, you see that we're expected to double our Medicare expenditures by 2017. It's actually much worse because it's in current dollars. But the key point is 96% of it is on chronic disease. We can wipe out our entire budget deficit, wipe out our non-competitiveness for jobs if we make the changes. Now, I'm going to just tell you that I'm a fan of Molly's. I am such a fan of Molly Katzen, and my whole family is, that we went every week, every other week for 4 years to Ithaca, New York, to visit her restaurant so that we could eat vegetarian. Only later did we learn that she no longer was there.
But you walked a lot of steps going and coming.
But the key, if you look at it from a cost standpoint, just look at this. This is the Congressional Budget Office designed through 2082, whatever it is, 70 years from now. If you look at the blue line, all non-health expenditures go down over time as a percent of GDP. There's only one problem America has to keep its freedom. There's only one problem we have for our budget. It is our health expenditures. That red line that goes up steadily. It can't do that, right? It can't do that because we end up losing our freedom. So the role that walnuts play, the role that your food choices play, the role that physical activity and absence of tobacco is to make that red line go flat or down. And I'm going to show you what happened at the Cleveland Clinic because we did that. And it's doable for large populations. If we can do it, anyone can do it. So we're at a turning point, both for society and for you, and it's totally reversed. Here's another patient at the Cleveland Clinic. This guy has, where white is where blood is flowing in a coronary artery. So I just want to show that. Here is what they call 98% lesion. So if you look here, this is that wide and you get a lot of flow through that. This is much narrower. These are exactly like Rocco had. And he got turned down for surgery at Hopkins. He came to the Cleveland Clinic and he got turned down by our surgeons too. And they said, "What?" He said, "Why?" He actually said, "What am I to do diet?" And he said, the doc said to him, "No, you can change your diet and eliminate 5 foods. You can walk 10,000 steps a day. You can meditate 15 minutes morning and night to deal with stress. And he didn't smoke. If he did, he would have said you can quit smoking." What happened? The guy said to him, "I can't walk from here to here 5 steps without having to stop for chest pain." So his doctor said, "Walk half that far 5,000 times." And in fact, he did, because he couldn't do anything else. And this was his coronary artery 2.5 years later. He pulled all the plaque out. Is that unusual? No, we do it to 1,500 guys a year. Everyone wants to do it because they do it. what you eat and what you choose to eat. And that's why I do this with walnuts. It's so important. Because omega-3 is one of those things that has been shown to make a difference. And the reason it makes a difference is you change how your genes function. All your genes do is make proteins or watch other genes. And which of your genes are on or not are your choices. Now I'm going to show you examples with cancer. And you're going to see, if you look at it, America is literally wiping out the deaths from cardiac disease because we figured out how to treat it and we figured out medications for it. And now what we're going to have to deal with, cardiac disease and stroke won't be the #1 killer, it will be cancer, but it's wipeoutable by the same exact choices. So this is probably the most important slide I show you, and I apologize because it's probably too technical, but there are 52 strips from guys with prostate cancer. I could show 4,000 from the same studies of breast cancer in women, but it is, you just have to buy it that it's 52 guys with prostate cancer. And they did an intervention. And then there are 52, the same 52 guys had their strips on this side. And what happened? You'll notice the strips went from red down in the bottom quadrant to green. What are these 5 genes? Those are the RAS family of genes that promote the growth of breast, prostate, and colon cancer. So by their intervention, by their action, they turned off the genes that promote cancer. Similarly, way up at top where it says ZNF 260 and SRF, whatever it is, P2, those are 2 genes that produce a protein called the GSTM1 and 2 proteins that cause prostate, breast, and colon cancer cells to commit suicide. They went from green off to red on. So what these guys do by those 5, what are the 5 things that they did? Or what are the 4 things they did? They did 4 things.
No smoking.
No smoking.
Ate
The
walnuts.
3 guys who smoked got rid of it.
Ate
What?
walnuts.
What?
Ate walnuts.
They eliminated 5 foods from their diet.
They walked.
They walked 10,000 steps a day, and they meditated 15 minutes morning and night. Same thing, by the way, for the 4,000 women with breast cancer. What's happened? Here it is. This guy had this. This is, by the way, a groin shot, guys. This is just the prostate gland. I always like to call on someone, so I'm here to call on you. Actually, I'm here to pick on that grower. Why do some doctors use 1 finger and some doctors 2 fingers while doing a prostate exam?
I can't answer that question.
It's second opinion. But anyway, so this is the prostate gland. It's walnut size. That's how we call it. It's walnut size. Here it is. And that's the tumor. And there it is a year later. It shrunk. In fact, of the 52 guys, only 1 has gone in 5.5 years now beyond lifestyle treatment for their prostate cancer. That is, all they do is walk, change food, avoid tobacco, and meditate 15 minutes morning and night. Same thing for the 4,000 women with breast cancer. So the foods to avoid: saturated fat, that's 4-legged animal fat, palm coconut oil, 2-legged animal skin. Trans fat, that's just partially hydrogenated vegetable oil, sugar, simple carbs, and syrup. These 3 just get metabolized to sugar quickly. So you only have whole grains and you don't have added sugar with food. And the problem is food is not let's make a deal. Most of us believe, well, I can have this ice cream cone tonight and then I will exercise it off tomorrow.